good evening. I hope you're all doing well. My name's Raffi. I'm a fourth year medical student. And today I'm going to talk to you guys about the tricarboxylic acid cycle. Now, I know you guys probably were sent a PowerPoint. I'm not sure, but I wrote tricyclic by accident for some reason. I was thinking tricyclic antidepressants, but this is not what this lecture is about. Now, the thing is, when we see the word TCA, we usually, if you're a second or third year, you'll think about the antidepressants. It's not because of the depression, it's just, and no, we learn about them at that point. But for you guys, TCA is tricarboxylic acid. Inshallah, you guys never need to know what TCA second and third year version means on a personal level. Anyways, so this lecture is honestly not that difficult. And I actually picked this lecture because so on the day that we were assigned lectures or the lecture list was available, I was actually studying the the tricarboxylic acid cycle for step one. And I saw that Abdulrazak sent it as an option. I was like, oh, okay, I saw this word today, let me pick it. So yeah, this is a very subhanAllah moment. You don't need to know any of this. These are just my personal notes on the slide. And just so you guys know what the slide looks like from your original PowerPoint, it's this. And then the citric acid cycle or the Krebs cycle, these are other names for the tricarboxylic acid cycle. So we can call it CAC, Krebs, TCA. Let's stick with TCA just so we're all on the same page. Now, the tricarboxylic acid cycle, this is part of a process we know as aerobic respiration. Aerobic respiration means it needs air. And in specific, we're talking about oxygen. So aerobic respiration is oxygen dependent. Now, before we get to the TCA cycle, we have this molecule called pyruvate. Pyruvate comes from glucose, and the process of converting glucose to pyruvate, this is called glycolysis. Glycolysis, which is this thing right here. Now, in the presence of oxygen, the pyruvate will undergo aerobic respiration, and what will happen is that it will get converted to acetyl-CoA, and this acetyl-CoA will go into this tricarboxylic acid cycle. If there is no oxygen, this will not happen. This pathway will happen instead, where pyruvate becomes lactic acid instead. So this is anaerobic respiration. But when we talk about TCA, we're talking about aerobic respiration. And TCA is the second step of aerobic respiration. First, we have glycolysis, which is in aerobic and anaerobic, and the other two, which is electron transfer chain and TCA, they're in aerobic only. Now, the conversion of this pyruvate into acetyl-CoA happens by an enzyme called pyruvate dehydrogenase. It's a complex. You don't need to know what that means, but pyruvate dehydrogenase converts pyruvate to acetyl-CoA. Now, usually, and this is a tip, by the way, for any sort of enzyme lecture, but when you see an enzyme with this name, it kind of tells you what it's going to do. So pyruvate dehydrogenase tells you that this is going to dehydrogenate pyruvate. So there's a hydrogen here, or there's some hydrogens here, and one or some of them will be removed. So we have pyruvate, and if you look right here, you have an H being removed and another H being removed. So you're dehydrogenating this molecule. That's one of the things that's happening. So pyruvate to acetyl-CoA, it makes carbon dioxide, and it makes NADH and H+. NADH is an electron carrier, and electron carriers are important for the electron transport chain. Now, the thing is, pyruvate, like we said, it makes acetyl-CoA and NADH. These two can go back and inhibit this step right here. So pyruvate dehydrogenase can be inhibited by acetyl-CoA and NADH, despite it making them. This is what we call feedback inhibition. Feedback inhibition. This is when we make products, and eventually these products come back to this enzyme to inhibit it. Now, you're probably thinking, okay, so when we make an acetyl-CoA, khalas, does we stop making after one? No. So in our body, everything needs to be balanced, including the molecules we make. So once we get to the amount we need, eventually we come back and inhibit it, so we don't make too much. So when we have too much NADH or too much acetyl-CoA, it inhibits this step. Okay, here are things we've mentioned already. And this is, so dehydrogenation is also oxidative decarboxylation. That's what's also happening. These are just other names. It's like we're saying the same thing, but using different words. So this is a dehydrogenase, and this is also oxidative decarboxylation. All right. And as we said before, this happens in the presence of oxygen. Now, the thing is, we have these coenzymes called the lovely coenzymes for nerds. And now, as a side note, one of the things I love about Dr. Hannah's lectures is that she puts mnemonics. And this is a mnemonic I remember up until this day. This is like, what, 3-4 years ago? Till this day, I remember the lovely coenzymes for nerds. So we have the, which stands for thiamine pyrophosphate, which is B1. Lovely stands for lipoic acid. CoA, FAD, and NAD. So these five coenzymes are the coenzymes needed for pyruvate dehydrogenase. Now, pyruvate dehydrogenase needs coenzymes. The function of a coenzyme, if you're not familiar, is to help the enzyme function. So if we don't have these lovely coenzymes for nerds, this PDH will not function. And if PDH does not function, so either we don't have oxygen or PDH doesn't work for whatever reason, this is going to happen. This pathway where we make lactate, ethanol, this is going to happen instead. So the most important of these is thiamine pyrophosphate, and it comes from B1. And the nice thing is most of these come from B vitamins. So thiamine pyrophosphate from B1, FAD, which comes from riboflavin, which is B2, NAD+, which comes from B3, which is niacin. Lipoic acid is lame, so it doesn't have a B vitamin, so there's no P4. And B5 makes CoA. So B1, 2, 3, skip 4, 5. And of course, they do care about some deficiencies with the TCA cycle. So when we have thiamine pyrophosphate deficiency or B1 deficiency, this is something we call beriberi, and this is very, very bad. Basically, what happens is that this is usually in a person who's an alcoholic, or like alcohol is usually the most common cause of this. But what happens is that this alcohol will inhibit beriberi, it will inhibit thiamine. When if there's no thiamine, there's no PDH function. If PDH doesn't function, we're going to go through the other pathway, which is anaerobic, which is going to make more lactic acid. It's going to make more ethanol. So as a result, you're going to have more pyruvates, lactate, and glucose. Or it's written here alanine, but glucose as well. And yeah, so alcohol inhibits the absorption of thiamine. That's one thing to know. If we have FAD deficiency, this is going to lead to dermatitis. And if we have NAD deficiency, this is going to lead to pellagra. Pellagra is remembered as the 4 Ds, which is dementia, diarrhea, death, and dermatitis. Yeah, just to recap. So pyruvate dehydrogenase needs these 5 coenzymes. Coenzymes function to allow the enzyme to work. If they are deficient, this enzyme will not work. We're going to go with the lactic acid pathway, the anaerobic pathway. So we'll have more pyruvates, lactic acid, and glucose. If B1 is deficient, this is what we call beriberi. It's usually due to alcohol. If FAD is deficient, it's going to lead to dermatitis. If NAD is deficient, it's going to lead to pellagra. And I know this might be a little bit confusing of information to add, but pellagra can also happen in alcoholics. So that's another thing to keep in mind. Now, arsenic also can inhibit pyruvate dehydrogenase by inhibiting lipoic acid. Now, a lot of you guys probably just came from high school. You may have remembered this word arsenic, but I don't know, maybe like you may not have studied it as much. You've probably seen the word arsenic before or know it from yourself. Arsenic inhibits a coenzyme called lipoic acid, one of the lovely coenzymes for nerds. As a result, if the lipoic acid is inhibited, again, I know I keep repeating this, but I want this idea ingrained to your head. If PDH doesn't work because of one of its cofactors or because there's no oxygen, there's not going to be acetyl-CoA. Instead, we're going to have more lactic acid. So there's also going to be vomiting, rice water stools, garlic breath, melines. So if you see rice water stools, garlic breath, melines, vomiting, these are hints that you're looking at arsenic poisoning. These are hints that you're looking at inhibition of lipoic acid. So they may tell you, for example, there's a patient who has like a suspected TCA disorder. We see that they have rice water stools and garlic breath. And they'll ask you, for example, which metal inhibits the enzyme, and you would say arsenic, or which coenzyme is inhibited here, and you would say lipoic acid. For these are just one thing you should do, by the way, is try come up with the types of questions they may ask you. This is one thing to help. Now, the thing is, which is really interesting, and this is another side point, but normally for first years, this isn't the first lecture I do. I actually used to do a lecture called Cell Communication. And if you guys were a part of pre-med, you may remember that lecture. And one of the things that happened in that lecture, which I felt was very important, was showing you guys my amazing animation skills. Yani, Salah, these are animation skills. They got me a job offer from Disney yesterday. So basically, we have pyruvate. And in the presence of oxygen, PDH will work along with its coenzymes. And we will have acetyl-CoA. So what will happen is in arsenic poisoning, it's going to inhibit it. So we're not going to have this conversion of pyruvate to acetyl-CoA. Instead, what we're going to have is this pathway over here. The LDH with lactate dehydrogenase, it's going to convert pyruvate to lactic acid. And this is anaerobic respiration. So what happens if we inhibit this? This is going to increase. So that's something I need ingrained in your heads. The last thing to talk about is pyruvate dehydrogenase deficiency. And this is a cause of congenital lactic acidosis. And by now, if you didn't pay attention to the last 4 minutes I said, please go back and rewatch those last 4 minutes because I explained how this happens. And you know what? Lala, I'm going to explain it anyways. Same thing. Just pretend we just don't have this enzyme. So instead of arsenic, we just don't have this enzyme. This is not going to happen. We're going to have more of this. Okay. And yeah, this causes brain problems. You're going to see hypotonia, acidosis, and seizures. So lactic acid is an acid, by the way. So it causes lactic acidosis. Lactic acidosis is when there's too much lactic acid in the blood. Okay. So far, do we understand? Do we understand? Just someone gives me a thumbs up or ask a question or ask me to repeat something. Adi. Okay. What are you kind of confused about? Yani, which points? The 4 minute one. Okay. I'm going to summarize those 4 minutes. I won't use this animation. Check like you don't like my animation, Salaha. So I'm going to use this. The idea is this reaction, pyruvate to acetyl-CoA, and I'll draw it for you. Play it. We use PDH, pyruvate dehydrogenase. Pyruvate dehydrogenase needs two things. First of all, oxygen. And the second thing is the coenzymes, which is the lovely coenzyme for nerds. طيب. There are three different things that we talked about. First of all, we said there may not be oxygen. All right. If there's no oxygen, this isn't going to work. We're going to have more here. So if this is blocked right here, this is going to increase. All right. And this is going to increase because it doesn't become this. So these two will increase, or mainly focus on the lactate. Lactate is going to increase. That's one of the things we talked about. We eliminate oxygen. The other thing is if we eliminate any of these coenzymes. If these coenzymes don't work, PDH will not work. And if PDH doesn't work, this reaction will not work. So we will have more lactic acid. And the last thing we talked about was aslan min al-bidaya, we don't have PDH. If there's no PDH, pyruvate will not become acetyl-CoA. We will have lactic acidosis instead. Is that more clear? Do you feel like you understood that better? وعادي, if you didn't, بعيد. I will come up with a million different ways to explain it if I need to. But I hope it's clear now. Alhamdulillah. Okay, خلاص, we can move on. Okay. طيب. Another thing is, what is a cycle? So I'm just going to read this slide to be honest. And a cycle, basically, we have a pathway and it regenerates a component. These are two examples of cycles. In this mole, you're going to take Krebs cycle. In the next mole, you will take urea cycle, inshallah. طيب. TCA cycle. Tricarboxylic citric acid, we've said all this. It involves the oxidation of acetyl-CoA. We've mentioned this. Then it goes into the ETC to make the ATP. And this is happening in the mitochondrial matrix. Yes, that's important, except for succinate dehydrogenase. Okay, so what are the main points? First of all, that you need to know, this, like it said in the previous slide, this is happening in the mitochondrial matrix. except for one step, which is succinate dehydrogenase. This happens in the inner mitochondrial membrane. So I'm going to just mark it in red for now. And know this step right here happens in the inner mitochondrial membrane. The rest of them happen in the mitochondrial matrix. طيب. What's happening exactly? So we use this pyruvate dehydrogenase. يعني فلسفنا واجد على البyruvate dehydrogenase. الحين وش صار? We made the acetyl-CoA. حلو. Is that it? لا. We need to make oxaloacetate as well. And this happens by pyruvate carboxylase. Now, this part of the TCA isn't as important. This cycle is very important. You need to be very familiar with the cycle. I know it's a lot, but I have mnemonics at the end to help you guys. Kind of, if they work. I hope they work, but don't count on them. First of all, we're going to make citrate. Citrate is the first part of the cycle that we're making. Citrate is made by the enzyme called citrate synthase. And like I said earlier, if you look at the name of an enzyme, there's a very good chance and it explains the function. So citrate synthase makes citrate. And it does so by taking acetyl-CoA and oxaloacetate, and it makes citrate. This citrate is going to be converted by aconitase to aconitate, and then aconitase works again to make the isocitrate or isocitrate. Citrate then gets converted to deisocitrate by aconitase. This isocitrate is going to be converted to alpha ketoglutarate by isocitrate dehydrogenase. This step right here makes NADH plus H. So what does this mean? This is going to be used for the electron transport chain, because one of the functions of this cycle right here is to make electron carriers like NADH and H. So this deisocitrate to alpha ketoglutarate is by isocitrate dehydrogenase. This step makes carbon dioxide. Alpha ketoglutarate is dehydrogenated to succinyl-CoA. This step also makes NADH, H, and CO2. So the dehydrogenases, for the most part, by the way, kind of do the same thing. They're inhibited by the same enzymes for the most part. All right. There are slight exceptions. This succinyl-CoA that we just made, it's going to make succinate by succinyl-CoA synthetase. The name of this enzyme, صراحة, is very misleading. Yeah, this is succinyl-CoA synthetase. This step right here actually makes GTP. And GTP is used for energy. So this is an example of substrate level phosphorylation. To learn properly about substrate level phosphorylation, learn it from electron transport chain. It makes more sense there. Because also that's a key concept for electron transport chain, not TCA. But this is an example of substrate level phosphorylation. Succinate is converted to fumarate by succinic dehydrogenase. This step, like we said, it does not happen inside the matrix. It happens inside the inner mitochondrial membrane. The inner mitochondrial membrane. Also, what's happening here, this coenzyme Q is part of the electron transport chain and the TCA. So that's an interesting thing. Fumarate is then converted to malate by fumarase, and malate to oxaloacetate is converted by malate dehydrogenase. And this dehydrogenase also makes NADH and H, but it doesn't make CO2. And then, of course, oxaloacetate, acetyl-CoA together make citrate synthase. So you see, we've used these enzymes, we went through them, and we came back to citrates. We came back. And this is how the cycle works. We go back to this enzyme, we make electron carriers, and then we keep repeating. Because that's one of the main functions, is the use of the formation of electron carriers. Believe that's the most part. One thing here is that FAD is used, and I have that written towards the end of my PowerPoint. So don't worry too much. I wrote any things that aren't written on the slides that you should know towards the end. I'm not expecting that right now you've memorized this. So take your time and try out my mnemonic. If it doesn't work, you've got 3 weeks until your exam. That's a good enough time to memorize this. But really, it's honestly pretty easy to memorize if you just remember that the enzyme most likely is related to whatever's being made or broken. All right. Key concept, the dehydrogenases all of the dehydrogenases make NADH and H, except for succinate dehydrogenase. And it's kind of easy to remember succinate dehydrogenase as an outlier. It doesn't make NADH and H. It doesn't happen in the matrix. It happens in the inner mitochondrial membrane. And it's also the reaction here that's part of a different reaction as well. Malonic dehydrogenase doesn't make CO2, but it does make NADH and H. So these are some things, I have them written towards the end, that you should know. Like, this is just repeating. These are the steps that make NADH and H. This step uses FAD and makes FAD H2. So succinate dehydrogenase, while it does not make NADH and H, it makes FAD H2, which is also used for the electron transport chain. So these are the steps that are used for making things for the electron transport chain, as well as the GTP parts. So look through this, take your time, spend a good amount of time, and you should be fine, inshallah. All right. So far, are we clear? Till now. And I wrote this here. Trying to play. Basically, one thing to note is that in berry, the lovely coenzyme for so all of the dehydrogenases are affected by the lovely coenzyme for NERD. So it's not just pyruvate dehydrogenase, it's anything with a dehydrogenase except for one. And the one that is the exception would be succinate dehydrogenase. Like, here is a picture of a reaction that we've already looked at before. But one thing you should know about this is the slowest step, this is the regulated step, this is the rate limiting step. The rate limiting step, this is the step that determines the whole reaction. It's the most important step of the reaction. It's very regulated. It's stimulated by calcium. So you should remember that calcium stimulates the TCA cycle. And you should also remember that it's stimulated by ADP. ATP and NADH inhibits the TCA cycle. So NADH and ATP, these are two products that are made by this whole cycle. So we call this process right here, and then we've made NADH, we've made ATP. We call this feedback inhibition right here. ADP and calcium, they stimulate the tricarboxylic acid cycle. And the step that they are focusing on, the step that is the rate limiting step, is the isocitrate dehydrogenase step, by the way. So this step right here is the regulated, rate limiting, and slowest step. We've mentioned all of this. Again, affected by the lovely coenzyme for nerds, especially alpha-ketoglutarate dehydrogenase. Alpha-ketoglutarate dehydrogenase is so important to remember. It's the most affected by the lovely coenzyme for nerds, obviously after pyruvate dehydrogenase. In this reaction, calcium, again, it's a stimulator, and NADH is an inhibitor, but succinyl-CoA is an inhibitor. So this reaction makes NADH and succinyl-CoA. This is another example of feedback inhibition again. But yeah. Here they're showing you berry, and like we said, this is a very, very bad thing. And no, this is a patient who's confused. They have foot drop, they're numb, they have wrist drop, weakness, they can't speak. And the usual patient is an alcoholic because alcohol inhibits the absorption of thiamine, therefore no B1, therefore no thiamine pyrophosphate, therefore no PDH, alpha-ketoglutarate, any of the dehydrogenases. Well, yeah, that's what happens in berry. So yeah. Succinyl-CoA synthase is another reaction that they like to focus on. So pretty much, this is an example, like we said, of substrate level phosphorylation. Again, focus more with that on the electron transport chain because that's more of something that they would discuss. But it makes GTP. The idea here is that there is substrate level phosphorylation, which makes GTP. So succinyl-CoA, succinate makes GTP. And the enzyme that does this is succinyl-CoA synthetase. This is what I would say is the most misleading step by name, like by the thing I told you guys earlier. So yeah, production of GTP. And succinate dehydrogenase is affected so it needs FAD. So this is the next step. So after this, succinate is then dehydrogenated by succinate dehydrogenase. So succinate dehydrogenase, basically what's going to happen is if we don't have FAD, and FAD is B2, it's going to cause dermatitis. So this is what we see here, dermatitis. This is inflammation of the skin. And this step requires FAD. Succinate dehydrogenase converts FAD to FAD-H2. So yeah, lip and mouth inflammations, and it's skin inflammation, so it's dermatitis. Now, there are two more concepts that they wanted to talk to you guys about. The first one about the TCA being amphibolic, and the second thing is about anaplerotic. Amphibolic, this basically means, and no, this reaction, or actually before we go into amphibolic, anaplerotic, up till now, are we clear? Salaha, we kind of went through the whole TCA cycle on this slide right here. Like we discussed the whole book. So we just discussed a little bit more specifics. So just to recap, this right here, isocitrate dehydrogenase is regulated slow, the rate limiting. The dehydrogenases, they're affected by the lovely coenzyme for nerds. So there's one you need to remember, it's alpha ketoglutarate dehydrogenase. And it can be affected in thiamine deficiency. Thiamine deficiency is called beriberi, affected in alcoholics. Succinyl-CoA synthetase is an example of substrate level phosphorylation. It makes GTP. Succinate dehydrogenase is the outlier. It makes FAD-H2 and it uses FAD. And these are pretty much the things that we've discussed outside. If there's the deficiency of if there's a deficiency of B2, it affects succinate dehydrogenase. It leads to dermatitis. But I feel like these are the 5 things that we discussed. Besides, of course, the activators and inhibitors, which are calcium activates, ADP activates, ATP, acetyl-CoA. I know I'm saying a lot of words, and they're written on the end of the slides, but I'm just recapping very briefly everything we discussed. Can you I'll repeat dermatitis. Okay. So right here, we have succinate dehydrogenase. Succinate dehydrogenase is responsible for converting succinic acid into fumarate. So this step requires FAD. FAD comes from B2, which is riboflavin. So this B2, what's going to happen is it's needed for this reaction. If it's deficient, it's going to lead to dermatitis. Dermatitis is inflammation of the skin, and usually the dermatitis that happens in riboflavin deficiency is on the lips and mouth. Dermatitis, B2 deficiency, no FAD, related to the succinate dehydrogenase steps, usually on the mouth and lips. Is that more clear? Alhamdulillah. Khalas. Okay, last thing we're going to talk about is amphibolic reactions and anaplerotic. So the idea of something being amphibolic, you've probably heard of amphibian, but the idea is if something is amphibolic, it is catabolic and anabolic. And here by amphibolic, they also mean that it's interconnected. How does this work? Anabolic, so you've probably heard the word anabolic steroid, especially if you go to the gym, aka Trenbolone guys. But the idea of anabolism is that you're making something. Here we are making the electron carriers, which are NADH and FADH2. We're breaking things here as well. We're breaking this acetyl-CoA. We're breaking it down to make something. So that's catabolism. And then interconnection, for example, as you guys can see here, alpha-ketoglutarate is related to glutamate. Succinyl-CoA is related to porphyrins and heme. Oxaloacetate, this is related to pyrimidine synthesis. So this is an idea of amphibolic reactions. And basically, we have making of the electron carriers, breaking of acetyl-CoA, and interconnection with a bunch of different other reactions. The other thing we have is anaplerotic. So here it's written down. This is just showing you the interconnection. This is showing you the catabolism and anabolism of the TCA. And then anaplerotic basically means that these are reactions that replenish the intermediates. And the anaplerotic reactions, we have the pyruvate step and we have the PEP carboxykinase step. These two steps, and as well, so PEP carboxykinase, which converts PEP to oxaloacetate, this is an example of anaplerotic. It replenishes the ingredients for the cycle. It's like, for example, let's say you're making a cake, and when you make a cake, you make a cake, it tastes good. You need to make more cake because you're going to eat the cake and you're not going to have any more cake. You want to make more cake. There are certain things you can do to go get more cake. For example, you can make more flour. You can make more sugar. Or I'm not really sure how to make a cake, to be honest. I don't even know I'm using it as an example, considering how unfamiliar I am with making a cake. But the idea is these are reactions, anaplerotic reactions, replenish the intermediates. So you have, for example, pyruvate to malate, you have PEP to oxaloacetate, you have pyruvate to oxaloacetate. The idea here is that you're replenishing the intermediates. That's anaplerotic and amphibolic. Do you guys understand those two words? And if not, I can repeat. أبشر. I'll repeat. Okay. So we have amphibolic and anaplerotic. Amphibolic basically means we have catabolism, anabolism, and interconnection. Anabolism means we're making something. So in the TCA, we're making the electron carriers. So that's NADH and FADH2. In catabolism, we're breaking something. And in this case, in terms of the TCA, we're talking about acetyl-CoA. And no, we break acetyl-CoA. And then we also have interconnection. So we described anabolism, we described catabolism, and now we're describing interconnection. Basically, in the reactions that happen in TCA, they can also be involved with other reactions for other different processes. For example, oxaloacetate could go on for pyrimidine synthesis. Succinyl-CoA can be related to heme. As alpha-ketoglutarate, this could be related to glutamate. The idea is these different reactions that happen in TCA don't just happen in the TCA. They can happen in other reactions as well. So we have anabolism, catabolism, and interconnection. Does that amphibolic part make sense? I'll get to anaplerotic, but I want to make sure you understand amphibolic. If you don't, I'll repeat. Okay, alhamdulillah. That makes sense. But anaplerotic is very simple as well. The idea with anaplerotic is these are reactions that replenish the TCA intermediates. So these are reactions that will bring back oxaloacetate. And if you go all the way back, was this it? Yeah. If you go all the way back, we need oxaloacetate because it's important to make the TCA cycle happen. The other examples they showed here where, for example, we need to make malate. Malate, as you saw in the cycle, it's an intermediate. For the idea of anaplerotic, these are reactions that make the tricarboxylic acid cycle intermediates. So very broadly, to keep it very simple, any reaction that will replenish one of these 1, 2, 3, 4, 5, 6, 7, 8, 9 different molecules. Any reaction that makes one of these 9 molecules and puts it in the TCA, specifically malate and oxaloacetate, these are anaplerotic reactions. So they're replenishing the TCA cycle intermediates. Does that make more sense now? By the way, thank you for asking me to repeat. And I enjoy repeating things. Thank you for asking. I appreciate it. Oh, it means I know you're paying attention. Thank you. Okay, we're done with the lecture, but I have practice questions and I have some summaries. I'll go through them quickly. So the steps that make NADH, because again, these are important. So isocitrate dehydrogenase, and I'm talking about the ones in the cycle only, not everything, including the pyruvate dehydrogenase step. But the steps that generate NADH are isocitrate dehydrogenase, alpha-ketoglutarate dehydrogenase, and malate dehydrogenase. The step that makes the other electron carrier is succinate dehydrogenase. It makes FADH2. The steps that generate carbon dioxide, so we have 3 things here. From this list, 2 of them make carbon dioxide. So it's the one that's not malate. Malate doesn't make carbon dioxide. CoA, I wrote this anyways, although it's not as important, but succinyl-CoA synthetase, and citrate synthetase. So the reactions that make CoA, they can be synthetases. GTP is made by succinyl-CoA synthetase, and this is an example of substrate-level phosphorylation. And succinate dehydrogenase is part of the electron transport chain, and it makes FADH2. Over here are the deficiencies summarized. Pretty much over here, we have B1 beriberi, confused, lethargic patients. It's associated with alcohol or malnutrition. B2 is riboflavin deficiency, so there's no FAD or FADH2. This affects the skin inflammation, specifically of the lips and the mouth. And B3 is called pellagra. There's no NAD or NADH, so it leads to the 4 Ds: death, dermatitis, dementia, and diarrhea. And then I tried making you guys some mnemonics. I'm sorry if they suck, but I know it can be a very lengthy process when you have 30 lectures to memorize, and any mnemonic can help, I guess. I tried giving you guys some mnemonics, بس عشان it makes things a little bit easier. Pellagra is for, okay, so yeah, Pellagra is an alcoholics. Berry and alcoholics. Um, Focus more on berry. I haven't seen a question on Pellagra, like from my experience with MOL. We haven't really gotten any questions with Pellagra. They focus more on berry. But I put it just in case. But yeah, Pellagra is associated with alcoholics. Berry is associated with alcoholics. Okay. This is for the enzymes. So the enzymes of the TCA cycle. So we have crying. Crying stands for C citrate synthase. Which is like you panicking or crying or whatever. It stands for aconitase because we have two steps that need aconitase. The first aconitase step, which makes aconitate, and the second one, which breaks aconitase. I for isocitrate dehydrogenase, M for alpha ketoglutarate dehydrogenase, suffering for succinyl-CoA synthetase, severely for succinate dehydrogenase, for fumarase, for fumarase, and months for malate dehydrogenase. It's in the notes of this section. If you don't know how to do notes, just press escape when you're looking at this PowerPoint. You'll see notes at the bottom. The lovely coenzyme for nerds, you should be familiar with this. Thiamine pyrophosphate, lipoic acid, CoA, FAD, and NAD. And then NADH, the makers of NADH, you can remember them as missing in action or MIA. So you have, for example, here, malate dehydrogenase, isocitrate dehydrogenase, alpha ketoglutarate. So MIA. I know the mnemonics are not the best, but I tried I tried. And I thought, let me make one on my own instead of looking up a good one on the internet, because the ones that you make up on your own are usually the ones you remember. So do you understand, Yani, this lecture? Is there anything you want me to go back and repeat before we go into practice questions? I have three practice questions. Two MCQs, one short answer. And I do need I will need your help to solve them. Just write in the chat what you think, and we'll explain. Okay, cool. Look, so I would recommend you go back and revise this. But if there are things you should pay attention to, try the mnemonics, look at the cycle itself, and if there's anything I didn't make any sense of, for example, my contacts on the front, let me know. But I hope, for example, I at least gave you guys something presentable, or you can go back, look at this lecture, and understand eventually, inshallah. But it's a simple topic. It just requires some memorization. If there's anything in particular you don't understand, please say so. Because if not, we'll go into the practice questions. Are you guys ready? Is there anything you guys want me to revise? All right. We'll go through the practice questions. And if something comes up that doesn't make sense, we'll explain it fully. Okay. So, okay, let's give practice question. I like that attitude. All right. Read the question and let me know when you guys want me to show you the options. And I'll just read it aloud just because usually that helps. So we have Ahmed, a 195-year-old man. I meant to write 19, but 195 works. Presents to the emergency department with complaints of severe fatigue, muscle weakness, shortness of breath. He also mentions experiencing frequent headaches and dizziness. Upon further investigation, the medical team suspects a metabolic disorder affecting the TCA cycle. The suspected enzyme produces FADH2. What other role does this enzyme have? Do you guys want me to show you the options? Like a thumbs up, like just a dot is good. Okay, please, option. Here are, oh, why did I write this many options? Okay, these are your options. So is it A, B, C, D, E, F, G, H? Is it okay? Uh, Other person, I don't know. Okay. So let's ask this, right? And I can get why this question might confuse a little bit of people. FAD H2. What enzyme makes FAD H2? It uses FAD to make FAD H2. Which enzyme is that? Okay. The enzyme that would make that is succinate dehydrogenase. Succinate dehydrogenase. So you were very close because the enzyme that does B is called succinyl-CoA synthetase. By the way, عادي, even if you don't pick up things quickly, that's completely fine. We all have our own pace. أهم شيء is that at the end, at the time of the exam, you understand. فعادي, even if يعني, you feel like you're going kind of slow, everyone has their own pace. Believe me, you're fine. But you were very close. I got to give you props there. The enzyme that makes GTP is succinyl-CoA, succinyl-CoA synthetase. The one that makes FAD-H2 is succinate dehydrogenase, which participates in ETC. You were close. Good job. Next question. We have Aziz Al-Arafi, a 19-year-old JoJo's Bizarre Adventure addict. He decides to start studying for his MOL exam, which is in 3 weeks' time. He opens up the lecture and spontaneously combusts due to severe confusion. Upon one of his friends finding him, he sees that he was reading about the TCA cycle. That the TCA cycle can be catabolic, anabolic, and interconnected. The friend also spontaneously combusts due to confusion. What is the definition of this property of the TCA cycle? And give examples. For this idea that something is catabolic, anabolic, and interconnected, what do we call this? And mashallah, very good. It's called amphibolic. Play it. For what is it? For this is anabolic, catabolic, and interconnected. For these are examples. For anabolism, making the electron carriers. Catabolism, breaking acetyl-CoA. Interconnected, oxaloacetate making pyrimidines, or anything we saw in that one blue circle. Last question. And this is a very long and difficult question. I will read it to you guys. A 52-year-old man is being evaluated in the emergency department for abdominal pain associated with watery diarrhea. His symptoms have been progressive over the last month. He says he is depressed and has difficulty remembering things. The patient has a 20-year history of alcohol use disorder. On examination, he appears disheveled. A pigmented, scaly skin rash is present in the malar distribution of his face, neck, and back of his hands. The rash has been present for several months and worsens upon exposure to sunlight. It is determined that the patient's symptoms are secondary to a lack of a specific nutrient. Which of the following enzymes is more likely to directly be affected by this patient's nutritional deficiency? Do you want me to show you the options? Yes, with exclamation marks, bad. Come on. Okay, these are your options. Okay, why do you think that's the answer? Like, what from the question makes you? I'm not saying you're wrong, but what makes you think that your answer is correct? What are your any key points? But I put the question here. Just tell me what makes you think that succinate dehydrogenase is correct. I'm not saying you're wrong. Okay. Babe, I get why you would say it's connected with B2 deficiency. But there's something from the question I want you to notice, which is this thing right here. To me, it's the most important thing. So read that. And do you still think your answer is correct? Or do you think another option is correct? Okay. So most likely what you thought was happening here was that we are looking at, you probably focused a lot on the rash. But the B2 dermatitis, or the B2 deficiency dermatitis, doesn't affect the hands and all that. It just affects the face, the mouth and the lips. The answer is alpha ketoglutarate dehydrogenase. The reason being, the enzyme they're talking about here, alcohol use disorder and other symptoms, the dermatitis and alcohol use disorder, that goes more with this right here, either B1 or B3 deficiency. Because like we said earlier, B1 and B3 deficiency are associated with alcohol. So they're more likely to be that. Succinate dehydrogenase would be correct, for example, if we said that he had inflammation of his mouth and lips. But good guys, good job with the try. Aslan, by the way, this question, I highly doubt they'd bring something this confusing. I saw this in like a USMLE prep book. I thought of including it. Don't feel bad if you couldn't get this. It's for step one, so don't worry. But I got it. I was like, oh, let me put it there. But do you guys understand why this is alpha ketoglutarate dehydrogenase? All right, alhamdulillah. Great job, guys. Thank you very much. And الحين, if you remember this at the end, you should feel very powerful. So yeah, fill this out, please. I hope I taught you guys well. I hope you found the session beneficial. If there's anything that you think I could improve, feel free to reach out to me. And of course, make sure you fill that out in the forms. And I'm very open to feedback. If there's something you feel like I did wrong, or I could have done better, or you found that I put something incorrect in my PowerPoint, just tell me. وعادي. يعني أنا صراحة, your feedback will help me and it'll help yourself. Because at the end of the day, this is your rights. يعطيكم العافية. Thank you, guys. Do you have any questions? Um, you can either ask now or you can reach out to me. How much did Disney? Oh, I signed an NDA. Good question. Good question. I like that. I signed an NDA, so I can't tell you how much Disney paid me. But let's just say they didn't. All right. Like, reach out to me if you have any other questions. Otherwise, take من عافية. Thank you very much for attending, and best of luck on your MOL exam.